Hi guys, today's topic about body mass index. So this body mass index is the simple measurement. Is a simple measurements for body fat according to the height and weight of the individual. So this is the simple measurements of body mass fat according to the height and weight of the patient. So what this actually means? BMI is equal to weight in kilogram divided by height in meter square. It means to calculate BMI, you should know weight and height of the individual. Suppose weight is 70 kg and height is 1.75 meter. Then what will be the BMI? So 70 divided by 7.5 square. So it will be around 22.9 kilogram per meter square. So this is the BMI. Now, what is the importance of this BMI? Increase risk with increased BMI. Risk with increased BMI. What are the risks? One is diabetes mellitus. So diabetes type 2 is common in more BMI cases. Second is hypertension. Hypertension is also increasing with the BMI. Third one is cardiovascular accident, also increase with the increased BMI. Fourth is OSA, obstructive sleep apnea, is also increased with the BMI. Other factor are hypercholesterolemia and other also, but these four is very important for the BMI, and these are the clinical implication of the BMI. Now, what is the WHO classification? WHO classification of BMI. If weight this BMI less than 18.5 kilogram per meter square, then it is underweight. Underweight, and that may be because of malnutrition or chronic illness. Malnutrition or chronic illness. That is called underweight. First category is underweight. Second category is between 18.6 to 24.9. That category is normal weight. Normal weight means this is under normal condition. There is no risk of any cardiovascular disease. Third category is 24.99, 25 to 29.99. This category comes under overweight. And these are the risk for mild risk for diabetes, hypertension, and cardiovascular disease and OSA. Fourth category is 30 to 34.99. This category comes under class first obese. This comes under class first obese. These are the cases of moderate risk of these four illnesses like OSA, CBA, diabetes type 2 and hypertension. Fifth category is between 35 to 39.99. This category is comes under class 2 obese. That is pre-morbid condition. This is the pre-morbid condition. It means there is severe risk of systemic diseases. And sixth category is more than 40. More than 40 come into class 3 obese, and this is very severe risk of these systemic illnesses like OSA, cardiovascular disease and hypertension. So these are the risks. What this BMI is not a diagnostic tool for these illnesses. It is a screening tool. Screening tool. And some ethnic group like India, this overweight should be more than 23 kilogram per meter square. And some athlete, this BMI may be on higher side, higher because of muscle mass. So you have to see individual muscle mass as well as ethnicity and overall picture of the individual, so that you will come to know which patient will going to be having the systemic presentation of the disease. Another fact is NC, neck circumference. If this BMI is high and neck circumference is also high, more than 17 inch or 40 centimeter, these are the risk of these four systemic diseases. So BMI tell us about what disease you can face in the future because of high BMI for chronic duration. So this is all about body mass index. Thank you so much.